So thank you once again. I'm Dr. Isaac recorded Nigeria, and I will briefly go through the data harmonization, the use of the line list among screening officers in the TBRW10 project towards harmonizing our data. Basically, the line list would appear like this in the WhatsApp chat room. So when you see this, it's going to be an Excel file. Just click on that Excel file and navigate to where you can have it open. It's going to appear this way. It's going to appear this way. So one of the challenge you might face is your inability to edit. So you just click enable editing so that you will have it will give you the opportunity to edit. So like we have discussed earlier, you should endeavor to put in your name up here. Always remember to put in your name as the screening officer and your phone number so that in the yellow box, put your phone number in the yellow box. So once again, who are those that should be line listed in this line list? Those who are supposed to be line listed on this line list are actually patients who have symptoms for substance use disorder, or patients who have symptoms of depression, or number 4, patients who have tuberculosis. That is, those who have been diagnosed to have tuberculosis. It is also possible to impute number 3, patients who are presumptive for TB, but that is not mandatory. However, if you are able to impute all your presumptive TB patients, it is very, very good and also recommended. So let us quickly go and see what it would look like to impute a patient. So let's say a patient's name is Ellen Mark, and Ellen Mark is a 23-year-old male who lives at 23 Nza, Enugu, with this phone number, and the date of screening was on the 23rd of October 23. LM is not presumptive for TB, so he was not evaluated for TB, had a PHQ score of 5 and an assist score of 2. So we are requested here to put substance with the highest score. Let's say the person uses cannabis, we indicate cannabis there. This for TB treatment is neither presumptive nor evaluated for TB, so we leave it blank. There's no need for this. And let's say the person commenced intervention on the 24th of October 2023, so we indicate accordingly. So some question might arise in filling this particular column, highest assist score. So let us entertain that patient briefly. If the highest assist score is 10 for alcohol, indicating that the patient does not have a substance use disorder for alcohol, yet the patient also uses another substance, such as cannabis, with an assist score of 5, indicating that the patient has a substance use disorder for cannabis. The question is, should I write a score of 10 for alcohol in the line list since it is the highest score? And our answer is no. You should write a score of 5 for cannabis. This is because even though it is the lower score, it is the event that clinically warrants substance use disorder and depression intervention for that patient. So let's go and quickly give an example on the line list. So let's just imagine a fictitious patient, Mary Sika, who is a 40-year-old female that lives in 2 Mango Lane, Enugu, and have this phone number. Screened on the 4th of February 2024, was presumptive for TB, evaluated, and was found positive using AFP, has a depression score of 2, indicating she does not need intervention for depression, and an assist score of 10 for alcohol, yet have an assist score of 5 for cannabis. So the question is, should I write 10 for alcohol here, or should I write 5 for cannabis? So the answer is that we should write 5. Even though 5 is the lower score, we should indicate cannabis. And the reason being that it is for cannabis that this person requires an intervention. Then we'll go on forwards to indicate the date when we were able to commence this person on MHSD intervention. Thank you for joining me once again.